Welcome back. 7:50 here on BT Vancouver. We're talking COVID-19 and the search for a vaccine. Medical teams all over the world are furiously trying to find out how we can tackle this virus head-on in the form of a vaccine. For more on this, we're joined by Professor of Epidemiology, Dr. David Fisman, joining us from Toronto. Welcome to BT, sir.
Thank you very much. Good morning.
Now, you've covered this extensively. You're one of the leading researchers in this field. How far away realistically are we to a vaccine for COVID-19?
Well, nobody knows. My best guess on this, and it has to be a guess because nobody knows, is 6 to 12 months from a vaccine that's in use at some level in Canada. You know, there's already a vaccine being fairly widely used in China, but that approach, the widespread use of that vaccine, hasn't really taken into account some of the safety thresholds and the clinical trial thresholds that we would demand to use a vaccine here in Canada. So I think we need to make sure vaccines are safe and effective. And I hope that's going to be in under a year, but we'll have to wait and see.
And Dr. Theresa Tam yesterday talked about the importance of widespread vaccinations in Canada. Why is that so vital to getting back to pre-pandemic levels here?
Yeah, what we need is something called herd effects. We need herd immunity. What we see with COVID is the folks who are most likely to die of COVID and be severely sickened by COVID are the same folks who are least likely to have a good response to a vaccine. That's older individuals and people with significant underlying medical conditions like immune-compromised states. You know, your immune system is weakened either by disease, by some kinds of cancer, or by medicines that are used to suppress your immune system. Those folks seem to have a rougher ride with COVID. What we know from flu vaccine campaigns is those are also the people who are least likely to be protected by vaccines. So it's a paradox with vaccines. The folks who are least likely to respond to them in terms of getting direct protection are also the people you most want to protect through vaccination. And what that means is that we're going to have to rely on vaccination of younger and healthier people to protect the whole population, particularly for COVID. Sorry.
No, of course, yeah. I just wanted to get your, can you give us a sense of the complexity of the logistics with respect to vaccine distribution? Because it's one thing to get the vaccine, but there must be so many other levels to actually get it to where people in an average community can actually get the vaccine.
Oh, yeah. Well, I mean, the first thing you have to do is what we're doing right now. There are a couple of hundred vaccine candidates at the moment, according to WHO, that are going through some form of clinical testing or trials. Canada's already bought stakes in 4 of the leading candidates, but those trials are still ongoing, so we have to make sure they're safe and effective. Then you get into having to scale up manufacture, which is probably the slowest part in this process. And for some of these vaccines, we don't actually have factories that can make them yet. This is the RNA-based vaccines. That's a totally new type of vaccine. So there's actually a need for like bricks and mortar construction of facilities to build. And then you get into, you know, if we have 1 million doses of vaccine and every vaccinated person needs 2 doses, that's 500,000 people out of a population of about 40 million in Canada who can get vaccines. So who are those, I'd say, lucky 500,000 people? How are you going to prioritize as vaccine starts trickling through? And it goes from there in terms of getting it into people's arms.
All right, fascinating stuff. We have to leave it there. Thank you so much for joining us today, and we'll check in with you as the story develops.
Yeah, thanks very much. Thanks for having me on.